Which of the following symptoms is not a danger sign of pregnancy? A. Fever or chills. B. Persistent vomiting. C. Increased urination. D. Vaginal bleeding. E. Swelling in face or fingers. The answer is C. Increased urination. It is important for the obstetric registered nurse to recognize the following danger signs of pregnancy: profuse vaginal bleeding, severe headaches, visual disturbances, abdominal pain, persistent vomiting, fever, chills, or swelling in the face or fingers. These may be signs of placental abnormalities, hypertensive disorders or pregnancy, maternal infection, or hyperemesis. Increased urination may be concerning to some women, but during pregnancy, the increased mass of the uterus induces pressure upon the bladder. Which of the following tests may be used to assess the risk for neural tube defects in the fetus during pregnancy? A. Alpha fetal protein, AFP, test. B. Ultrasound. C. Non-stress test, NST. D. Chorionic villus sampling, CVS. E. Amniocentesis. The answer is A. Alpha fetal protein, AFP, test. The alpha fetal protein test is the only test that can predict neural tube defects in a fetus during pregnancy. CVS can detect fetal karyotype, sickle cell anemia, phenylketonuria, PKU, Down syndrome, and Duchenne muscular dystrophy. Amniocentesis can detect genetic disorders and lung maturity. Ultrasounds provide images of the fetal position, measurements of the fetus and placenta, and can confirm pregnancy and gestational age. Non-stress tests, NST, are used to record fetal heart rate to assess fetal well-being after 28 weeks gestation. What is the proper management of atypical squamous cells of undetermined significance, ASCUS, or low-grade intraepithelial lesion, LSIL, in women aged 21 to 24? A. Cervical conization. B. LEEP, loop electrosurgical excision procedure. C. Repeat cytology in 1 year. D. Repeat cytology in 6 months. The answer is C. Repeat cytology in 1 year. ASCUS or LSIL in women aged 21-24 should be managed by repeat cytology in 1 year. Neither cervical conization nor LEEP, loop electrosurgical excision procedure, would be appropriate in a patient of this age or presentation. What follicle-stimulating hormone, FSH, and luteinizing hormone, LH, levels would be present in a patient with premature ovarian failure? A. FSH greater than 120 micro-international units per ml and LH greater than 80 micro-international units per ml. B. SH greater than 25 micro-international units per ml and LH greater than 40 micro-international units per ml. C. FSH greater than 40 micro-international units per ml and LH greater than 25 micro-international units per ml. D. FSH greater than 80 micro-international units per ml and LH greater than 120 micro-international units per ml. The answer is C. FSH greater than 40 micro-international units per milliliters and LH greater than 25 micro-international units per milliliters. Premature ovarian failure is the loss of ovarian function in an individual under the age of 40. A FSH greater than 40 micro-international units per milliliters and LH greater than 25 micro-international units per milliliters would be indicative of this condition. What are the signs and symptoms of ectopic pregnancy? A. Cramping and abdominal mass. B. Nausea and diplopia. C. Fundal tenderness and vertigo. D. Abdominal pain and vaginal bleeding. The answer is D. Abdominal pain and vaginal bleeding. The most common symptoms of ectopic pregnancy are moderate to severe abdominal pain and vaginal bleeding. Pain may be cramping or sharp. Bleeding can be heavy and the individual can even begin to bleed into their abdominal cavity. Ectopic pregnancy is not consistent with fetal survival and requires treatment with methotrexate or, in the case of bleeding, surgery may be indicated. A patient tells her nurse that since week 26 of her current pregnancy, she has been experiencing a raised, itchy red rash on her abdomen and chest. This is her first pregnancy. She has never had this before and she has made no other changes in diet, detergents, or lifestyle. Which of the following might describe her condition? A. Urticaria from food allergy. B. Heat rash. C. Pruritic urticarial papules and plaques of pregnancy, PUP. D. Dermatitis herpetiformis. The answer is C. Pruritic urticarial papules and plaques of pregnancy, PUP. The most likely cause of her rash is pruritic urticarial papules and plaques of pregnancy, PUP, a condition affecting about 1 in every 200 pregnancies. While she could be having an allergic reaction, dermatitis herpetiformis or urticaria, or an inflammatory eruption such as heat rash, these are less likely due to their absence before pregnancy and the absence of any significant changes in her diet or lifestyle. How is glomerular filtration rate, GFR, affected during a normal pregnancy? A. Decreases by 15%. B. No change. C. Increases by 15%. D. Increases by 50%. The answer is D. Increases by 50%. In the average normal pregnancy, the GFR increases by upwards of 50%. This correlates with an overall 50% increase in blood plasma volume. The term placenta previa describes which of the following conditions? A. The placenta separates from the uterine wall. B. The placenta develops before the uterine lining is mature. C. The fetus is inferior to the placental position. D. All or part of the placenta is positioned between the fetus and the cervix. The answer is D. All or part of the placenta is positioned between the fetus and the cervix. In placenta previa, the placenta develops in such a way that all or part of it is positioned in the lower 1/3 of the uterus, placing it between the fetus and the cervix. This can cause the placenta to tear and bleed. The most common sign is painless vaginal bleeding in the 3rd trimester, generally after week 32. A 25-year-old female primigravida presents to the clinic for a prenatal visit and is concerned with new onset skin changes she has noticed lately. The nurse caring for this client is aware that there are several skin changes associated with pregnancy. All of the following are skin changes associated with pregnancy except dash. A. Palmar erythema. B. Subclinical jaundice. C. Chloasma gravidarum. D. Heger's sign. E. Linea nigra. The answer is D. Heger's sign. Heger's sign is indicated by a softening of the portion of the uterus between the uterus and a portion of the cervix. The remaining choices are all examples of various skin discolorations commonly associated with pregnancy. The nurse advises a woman with mild preeclampsia to do all of the following except dash. A. Check blood pressure often. B. Limit water intake. C. Weigh herself daily. D. Measure the protein in her urine. E. Keep track of fetal movement. The answer is B. Limit water intake. It is not necessary to limit water intake in women with preeclampsia. It is important that women with preeclampsia drink at least 8 glasses of water per day. The ingestion of water may even help reduce swelling. Checking blood pressure and body weight frequently are important in tracking fluid levels. It is also important to keep track of fetal movement and notify a provider immediately if decrease in movement is noted. Women who are preeclamptic may spill protein into their urine as a result of malfunctioning kidneys.